podcast platforms. You could find us on YouTube, and please remember to subscribe. You could find us at realmeneatplants.com. My guest today, Ken Beckman, is an actuary at INS Consultants. I previously served as Senior Vice President and Actuary at Central States Indemnity. He has 30 years of insurance and actuarial experience, primarily in health insurance pricing and valuation. After learning about and personally adopting whole food plant-based nutrition more than 10 years ago, he's been actively writing and speaking about the topic both within and outside the actuarial profession. He is president and co-founder of Actuaries for Sustainable Healthcare, and my membership has lapsed, Ken, on that. But you're president of Actuaries for Sustainable Healthcare, which is an international association of actuaries dedicated to achieving sustainability of healthcare financing systems through the use of whole plant food nutrition. Ken, welcome to the show.
Thank you very much, Glenn. Glad to be here today.
So, what's your story? And by the way, you have a lot of initials after your name, professional initials: ASA, ACAS, MAAA, and CFA. So that's a lot of degrees, I guess.
Well, the actuarial profession likes initials, and so there's a lot of different ones, and you take certain examinations, certain certifications, and then they give you initials after your name to show that you have done the work. So that's what some of those things are.
All right, so I have to ask the question. I know everybody's thinking it, you're thinking it, I'm thinking it, everybody's wondering. It's a little personal, so you don't have to answer if you don't want to. But did you go into the actuarial field for the groupies? Is that what interested you in the field?
No, I was maybe one of the few that didn't, but
okay. All right. So tell us your journey to whole plant food nutrition.
Well, I'll tie it a little bit to the actuarial profession. So early on in my career, I worked in health insurance and have done so the most of my career. And so I was involved in products like Medicare supplement insurance, cancer insurance, things that we saw a lot of older folks obviously take advantage of. And I noticed, claims were going up and up. And, there seemed to be this just upward trajectory. There was no really end in sight for these large claims that we're seeing. And I would dig into it and try to find out, what was causing all this. And I felt as an actuary, like you mentioned, I've taken these exams, these certifications. I had some knowledge behind me. I should be able to figure this out and help our policyholders, because the actuarial profession actually has a code of professional conduct that we are obligated to act in the best interests of the public. It's really not to serve the companies we might work for. That's important, obviously, but really our end customer, our end person that we really have to keep in mind as we do our work is the public, the general public. And so with that in mind, I wanted to do something to help these folks, but I could never figure it out. Did a little research and tried to understand why these claims were going up and up, and people were having all these cancers and heart diseases and taking expensive drugs and expensive procedures. And I couldn't figure anything out. So I just kept, working on it day after day, doing my regular job. And what that involved is looking at this data and coming up with rate increases that we would then, the company would then pass on to the customers, because the rates for those products were no longer adequate. The claims would, they would need additional funds to pay for the increased claims that they were seeing. And so that was really my main job, is to then work with our state insurance departments across the country and justify that. And, I was very successful at that, getting those rate increases approved and making the case that experience was bad, people are unhealthy, and we needed more money to pay for that.
Right.
Um,
So nobody wants to raise the rates, but the companies have to be profitable and the claims are going up.
right.
The population is getting more and more overweight and more sick.
Mhm.
And so you're stuck in that um, unpopular, if you could say, position of having to need to approve increases, right?
Right, right. You got to pay for the promises that the insurance companies have made and be able
Right,
to pay those out when the people need those funds.
right.
And so, like I said, I could not really find a solution to that. And then about a little over 10 years ago now, um, my wife's brother had a fairly massive heart attack, almost died. And so that got her to thinking about us. What he was quite a bit older than we were, but uh, was there something we could do to maybe it was hereditary, we don't know. Was there something we can do to prevent something like that from happening to us? And so she looked around and stumbled upon this class about plant-based cooking, and
Mhm.
we didn't know what that was, but it sounded interesting. So she took it and really latched onto that quite quickly and tried to communicate it to me, but it took a little longer, and then I finally sat down and watched Forks Over Knives about 6 months after she took took that class, and that's all I needed. That was all the evidence, and I changed my diet overnight to whole food plant-based, and haven't looked back since. And it was really kind of the light bulb that went off. Tying the actuarial uh, experience that I had, my search for what the answer was. Why are all these people getting sicker and more obese and things like that? And it really just that was the answer I was looking for. It was hiding there in plain sight all that time. So
So you're another Forks Over Knives vegan. There are a
right.
lot out there. I think for people who become vegan for health, that's the documentary that has created the most vegans. And then there's Earthlings for people who become vegan for the animal.
Right.
Um, so did you and or your wife experience any health improvements from going plant-based?
We did. I mean, I personally didn't really realize it. It was never really told by my doctor, but I was borderline overweight and I lost 30 pounds, in a matter of, a few months. I don't know exactly, but, lost about 30 pounds.
Well, let me interrupt you there. You say you were borderline overweight.
Mhm.
If you lost 30 pounds, you were overweight, right?
Well,
It's
my
just that,
BMI was
yeah,
about 25, so that's, right on the border there. Yeah.
yeah, okay. But it, in my case, for example, nobody's ever called me overweight. But when I gave up oil, I was already vegan, but when I gave up oil, I lost 15 pounds. So in my mind, I was overweight. I mean, I didn't need those 15 pounds, right? Do I need
Right.
15 pounds of oil?
That's
So,
right.
so in my mind, when people lose the weight and get down to their healthy weight, they were probably a little bit more than they probably would weight a little more than they needed to, even if they, you know what people called me when I was 15 pounds overweight? They called me skinny. You know, it's just this American standard that
Yeah,
we're up
yeah.
against.
Yeah, our standards are not quite ideal. There are certain standards, but just like cholesterol being 200, it's
Yeah,
it's the standard, but that doesn't mean it's healthy.
right. So you lost weight and your wife?
No, I mean, she really didn't have that little
Right,
extra that I did, and
right,
but we both felt better, much more energy and that type of thing. Lower, again, just for me, but lower blood pressure, lower cholesterol, and so
right.
yeah, just a lot more energy to be able to do things we wanted. I mean, we didn't have any, chronic conditions, but I think they were certainly developing, and we could feel, even though we didn't have them, we could feel the very positive impact of making those changes very quickly.
Okay. So then you go back to work, and do you find yourself wanting to say to everybody, hey, Eureka, I know how we can turn this around. Is everybody listening?
Yeah, I after a while that was certainly part of the discussion, and I was fortunately at that time in an insurance company that was very receptive to these ideas of wellness and things like that, and so we actually did a pilot project, and like I said, I managed a Medicare supplement block of business, and we actually sent out a copy of Forks Over Knives to many of our insurance policyholders who had
Really?
Medicare supplement. And we said, we weren't trying to tell them what to eat or how to run their lives, but we said, here's a film. We would like you to view it on your own schedule, own time frame. And, it's been shown that you can reverse heart disease, diabetes, obesity, some of these other things. And please take a look at it and let us know how it works out for you. And so we've got very positive feedback on that. Obviously, not everybody adopted it, but we got several positive comments back that people tried it and had good results. So that was
Well, how many
what I
people
always tell
were you
people.
literally shipping the DVD?
We had the literally shipping the hard copy of the DVD through the mail.
So how
And
many copies did you send out?
we sent out about 500 copies in our initial test phase, and then we did a later pilot that we didn't actually just ship them out. People could request them, and we did that to about I think about 40,000 in total. Not and that people had to write back to request them, but the initial phase, we people didn't know it was coming. We just sent it to them cold in the mail, the physical copy.
Okay. Did you do any statistical dive into that to see if claims went down from those people?
We looked at it a little bit. It's a little difficult just because of the way the data is, and
Yeah.
we didn't inquire really whether people actually did it or not. We didn't question them on that, but it appeared it may have had some effect. But from a statistical credibility standpoint, it's not entirely credible. But overall, I think it did good. Probably the most interesting comments we got, and we got multiple of these, is that it felt like their insurance company was caring about them. I
Uh-huh.
think people are used to their insurance company; they just want every penny and just want to take their money. But we've got several comments that people felt like we as their insurance company were doing something for them, concerned about their health and something like that.
Right. Now you're based in the Midwest, right?
Yes, in Omaha.
Okay, so did you hear back from any people in the animal agriculture industry to mind your own business?
No, we didn't.
Okay.
At that time we had business all across the country, mainly in the Midwest and the
Mhm.
South, actually. And no, we didn't get any negative feedback. So that
All
was that
right.
was very encouraging.
All right. Well, this brings us to a complex subject, which is it in the interest of insurance companies to reduce claims? Um, and as I understand it, while you would think that it would be in the interest of insurance companies to get everyone healthier on a whole plant food diet, reduce claims, and thereby they would be more profitable. The reality is that, especially under the Affordable Care Act, they are only allowed to charge a certain amount, in that they must be paying at least 80% of their revenues in individual insurance, and I think 85% in small group insurance. um, to cover claims. And so if their claims go way down and they're becoming more and more profitable, then they just have to lower their premiums. And so if they're paying 80% or more in claims, that gives them a nominal profit margin of 20%, but then they have overhead. You have to pay insurance agents and so forth, and they wind up with a 3 or 4% profit margin. And whether the claims go up or the claims go down, there's still going to be a 3 to 4%. So if claims go up, then it's 3 or 4% and their premiums go up, then 3 or 4% of a higher number. So am I right that there isn't a lot of financial incentive for insurance companies to help make the population healthier?
That's right, Glenn. You've stated that accurately. So it's, whether it's 3 or 4%, that number stays fairly steady for all insurers in the industry. And 3% of a bigger number is more money in the pocket than 3% of a smaller number. So there really is no financial incentive for insurance companies to really stand up and bring this message to their policyholders and reduce claims, because it really comes directly out of their bottom line, not in percentage terms, but in actual dollars, and that's what you can take to the bank. So
Yeah.
I
So
will
go ahead.
I will say, so that's for insurance companies. Now there is an incentive for those organizations that are self-insured. And so,
Right.
as you may know, many large employers are self-insured. They may use an insurance company to be their third-party administrator to administer those claims, but it's the large employer that's actually taking on the risk. And so those claims come directly out of their bottom line. So for large employers, self-insured entities, they have a great deal of stake in making their really their employees making their employees healthier and letting them know about ways to prevent and most significantly reverse some of these chronic illnesses.
And are there any cases of those large companies um, learning that lesson and taking initiatives to get their employees on a healthier diet?
I have not really seen any, what I would say, really large companies do that. There could be, but I'm not
Yeah.
aware of any of the, our
Yeah.
major large size employers doing that in conferences and things like that. But I find it difficult for people to actually move, act on that information unless they themselves are plant-based and understand how it works in their own situation. So we haven't seen a lot of movement in the insurance industry. And like I mentioned, that, even though insurance companies don't have that incentive, they work with some of these large employers being their administrator for these self-insured programs. But again, don't see any movement to bring that message to these employers either. But yeah, unfortunately, I wouldn't say it's resistance and that type of thing, but just kind of that's interesting, but I've got more important things to do.
Uh-huh. What's the vegan scene like in Omaha, Nebraska?
Well, I I'm part of an organization, co-founder of a local nonprofit. We're called Lifestyle Health Alliance, and we have put on several large conferences. Our first one, we got over 1,200 people to attend, and we brought in uh, national speakers to come and present their research. And so we've got a very positive response, large attendance at some of these conferences that we've done. and trying to just get out the message among our local community here. And I think people are receptive to it. It's obviously slow, like I think it is everywhere. But I think people are very open and wanting to hear it, especially we find, we attract an older audience to some of our events, and I think that's just natural because these diseases have been building up, 30, 40 years and 50 years or more, and people are starting to feel it in their, 40s, 50s, 60s, 70s, and they're looking for an answer and they haven't found it from their regular doctor. So we kind of fill a little niche, I think, in presenting a different perspective that maybe they haven't heard before. So we just try to make everyone welcome and lay the information out there and really emphasize the fact that these conditions are, in most cases, reversible. And that's the exciting thing. It's not just about a wellness approach. It's not about, taking an extra 2,000 steps and things like that. I mean, if you really are serious about the way you eat and, be plant-based all the way and eliminate all the junk that sometimes goes along with that, just whole food plant-based, you can really make a big difference.
Now, speaking of big differences, was it a huge difference in your own life? Did you used to be a big meat eater, and were, when you went overnight, it seems plant-based. Did you just go through the freezer and throw out, get rid of all the meat? Oh, how did that big difference play in your life?
Yeah, it was pretty much overnight. Just threw out all the bad stuff and started eating the good stuff, and it was not a difficult transition for me at all. It was all tasted delicious, and it was and then after about a couple of weeks you start to feel the physical difference, and at that point there's no going back. So, and I know people are on different time frames and all that, but for me it was almost instant. And I wouldn't say I was a huge meat eater before, but I certainly, I'm sure at least once a day had a piece of animal product on my plate, unfortunately. And I'm just glad that all that is behind me at this point.
Yeah. So you're 10 years vegan now?
Yes, yes.
So it was surprisingly easy for you. Were you surprised at how easy it was?
Yeah, I think I was a bit surprised how looking back now how easy it was. I mean, I think what made the difference for me is just having that scientific evidence laid out so clearly, not only in Forks Over Knives, but some of the other research that's out there. I mean, if if you just read it, it's just you can't refute it. It's just so simple and straightforward that I don't. It's really not anything to think too long about. About 15 minutes. Okay, yeah, that's the thing. That's the right thing to do.
Now, I'm sure, like most of us, you probably have a majority of your friends who are meat eaters. Uh, does the subject come up a lot? Do you debate with them, or is it something nobody talks about?
I find it that it's most useful when go out to eat with a group of friends or colleagues or whoever it is that you're not, you may not see a lot. And it's just it's very instructive. So I certainly don't try to debate anybody, but simply the fact of ordering at a restaurant is an educational process for the other individuals because you say okay, I see you have in this menu, can I modify it with X, Y, and Z and that type of thing. And so then that gets other people asking questions. And so it's really, I think it's a great opportunity for me to then explain why I'm saying this to the waiter or that type of thing, and just a very educational process. And I think people are generally curious about what I'm doing and why I'm doing it. And so I don't have to make a big presentation, but it's simply responding to their questions, and I think that works quite well.
And are there any vegan restaurants in Omaha?
There's a couple. Yeah, there are a couple pretty good ones, and so try to support those when we can. And the restaurant business is tough,
Yeah.
whether you're vegan or not. So yeah.
How strict do you try to be with your diet? Do you try to avoid oil, try to avoid sugar?
Yeah, I do avoid oil definitely. I believe that's really very anti or very inflammatory and just it's not a health food
Yeah.
certainly. So, every once in a while at a restaurant you may get a little bit, but try to avoid that as much as possible. And sugar, I don't seek out products with that in it either, but I one of the slides I have in my presentation that I give to actuaries is point out that sugar, while not a health food, that's really not the issue. I mean, if you look at sugar consumption in the United States, it's actually gone down quite a bit over the past few years, and so that's really not what's driving the obesity and this chronic disease illness. And so again, not a health food, not something I promote, but I don't get too hung up on that.
So you do a presentation to actuaries on this subject?
Yes, at different actuarial meetings. So, for example, at the last two international congresses of actuaries, this is where actuaries from around the world, the last one was in Sydney, Australia. They come together to talk about various topics, and I was able to be a speaker at that and presented the evidence, all the research that's out there, and so yeah, again, it's you don't know how people are going to react, but very favorable reaction. Got a lot of good questions and discussion after the presentation.
Do you feel that you've turned some other actuaries vegan?
Well, I don't know. I don't know about that, but as you mentioned in the intro, one of the organizations that I co-founded, Actuaries for Sustainable Healthcare, this came out of meeting other actuaries at these various meetings across the country, and they had independently came to the same uh, way of lifestyle that I had, and so we got together and founded this organization. And it's really just a forum for actuaries to exchange information and to discuss research that's been out there and hopefully educate our colleagues and the companies that we work for and interact with about how powerful this plant-based nutrition can be in preventing and reversing diseases. So
Yeah.
we've got we actually have now members from like 13 different countries that are part of this.
Maybe it would be a good idea if people who do nutritional research um, got to know more actuaries. And here's why I say that. One might read a study about, for example, colonoscopies. And I'm making up the numbers here, but they might say that um, colonoscopies have, you know, there's a 3% chance if you get a colonoscopy that it'll save your life, and the risks of harm are very, very small, or 0.1% or whatever, and therefore we, the medical community, recommend getting a colonoscopy at age 40, and then whatever they recommend every 5 years or whatever till age 7. But they are doing that on the general American population. So it may well be true that colonoscopies save lives for people who eat the standard American diet. And it may also be true that colonoscopies have more risk than reward for people who eat the whole plant food diet. And I'll give you another example as someone who has, in the last 2 years, had 2 hernias repaired. They will make the case for getting mesh, hernia, inguinal hernia surgery using mesh, a plastic mesh. And they make that case because there is a lower chance of recurrence using mesh. I was told 50% lower. And then that was, of course, in relative terms. So I asked for it in absolute terms. It was 1% versus 1.5%. So that was 50% lower. But it turns out that that risk of recurrence goes way up the more you weigh. You know, with BMI over 30 and so forth, your risk of recurrence. So the risk of recurrence for a slender person with hernia repair is very, very low. But they don't seem to have actuaries around them to break it down to give the public numbers that are meaningful. And so I'm so glad I didn't get the mesh because my chances of recurrence are extremely low. I'm not sure that they would have been any lower with the mesh. And since there's a risk either way, you're 1,000 times better off not having mesh if you're going to have a recurrence, because then you've got the tissue growing around this piece of plastic in your body. So do you see a role for actuaries to help research scientists, nutritional research scientists, give more accurate and relatable data in their studies?
Oh, absolutely. Yes. I think those examples, absolute relative risk, that's huge. And so I think anything actuaries can do to shed a little practical light on things, that's absolutely.
Yeah. And I think for so many studies that they do, there should be an asterisk. This study is done on the general population, not on people eating a healthy whole plant food diet.
Right.
And it would be lovely to see more studies on people who eat food that's natural for the human body.
And I think this is a little bit unrelated, but I think it should really be standard practice if somebody is prescribing something. Now, maybe it doesn't apply in like the colonoscopy example or the hernia example, but if you're prescribing statin drugs or you're prescribing a coronary procedure, to also prescribe whole food plant-based diet. I mean,
Yeah.
it should really be mandatory to put those side by side and like you
Right.
say, give the absolute risk, relative risk of all those. And obviously for plant-based diet, the risk is zero. So
Right.
just lay it all out there.
Right. Yeah. And that's really the sin, is those cardiologists who don't even mention the whole plant food diet. You got your choice of uh, uh, pharmaceuticals or surgical intervention. Which do you want to go with?
Mm-hmm.
Instead of also including eating food that your body was designed to eat.
Mm-hmm.
Um, so do you find that that with this new way of eating, you go to the doctor less often?
Oh, absolutely. Yeah, I couldn't tell you the last time I went to the doctor. So
Do you believe in going to the doctor for an annual checkup?
I don't personally.
Uh-huh.
I mean, maybe it works for some people, and I have no issue with that, but I just don't.
Yeah. There is a case to be made that going for that annual checkup sometimes leads to more interventions than are necessary.
Mhm.
On the other hand, I like to just monitor my blood work. If I
Right.
monitor my blood work, I feel that's all I need.
Absolutely. That's very important. Yeah.
Um, and have you seen any growth in the vegan community in Omaha?
I think so. It's a little hard to measure, but for our nonprofit organization, we seem to continually see new people at our events that we haven't seen previously. So I would say it's slow but steady.
Well, it's good to know that in Omaha, people are open to it, and you don't seem to be encountering a lot of resistance.
Yeah, I think people are very open to it. If you present it in a way that says, you can avoid some of life's most tragic things. And now even we're seeing very promising research that says you can slow down and possibly even stop Alzheimer's disease. I mean,
Right.
there's nothing, how can anybody argue with that? I mean, the
Yeah.
research that's out there now is just so powerful that really that should be the message. If anybody has any concerns with plant-based way of eating, just show them that research and others, and it's just incredible.
Yeah. And that makes me wonder because there are so many debates about the best way to lose weight. There's the ketogenic diet where people are eating a high fat diet. It's usually animal foods. Apparently, it doesn't have to be all animal foods, but ketogenic diet or the paleo diet or the carnivore diet where they're eating a lot of animal foods. And there are people who claim that they've lost weight that way, and I believe them. There are different explanations for it, but for one thing, they're not eating a lot of pastries, so I guess there's that. And uh, you know, it may be true that some people lose weight with those sorts of diets, but there has never been a case where a paleo or carnivore doctor tried to replicate what Dr. Esselstyn has done, saving lives in heart patients on a whole plant food diet. Nobody's ever put heart patients on a sausage diet and reversed heart disease.
Right.
Nobody is claiming they could reverse Alzheimer's with beef stew. It's all whenever there are even cancer. There's the case of the Gerson therapy where people flood their bodies with carrot juice and beet juice, and some people have apparently reversed cancers. But you never hear about reversing cancer, by drinking milkshakes.
Mhm.
So it always seems that when there are remarkable stories of health improvements, it's always plant foods. It's never animal foods.
Mhm.
And I feel like, can't we just extrapolate from that it's probably better for your weight too? It's probably better for all kinds of things that we haven't proven yet, because nothing else will reverse these diseases in a dietary context other than plant food.
Mhm. That's absolutely true. And part of my presentation that I do, I really dive into the data related to obesity because there's very clear data out there, worldwide data from the UN and the other organizations that look at a worldwide perspective. And if you look at the calories consumed from animal foods and oils, they have gone up almost lockstep with the rate of obesity increase in the world. And in the US, it's much greater than the rest of the world. But if you look at the worldwide data, that consumption of animal products, oils, essentially processed foods, um, it's almost a one-to-one correlation with the rate of obesity increase. So it's just
Mm.
it's so clear. Yeah.
Mm. Well, Ken, it's been a pleasure speaking with you, and please keep up the good work within the actuary world and the insurance world to be a voice of reason there to see if somehow that industry can weigh in on the health crisis. And do you have any papers or other accomplishments that you've, because I know you've written on the subject that people can access?
I do have a paper out there that's been published in the American Journal of Lifestyle Medicine, and really what it lays out is an incentive system that if really self-insured employers or any other payers of healthcare, could be the government, potentially Medicare, Medicaid.
Mhm.
And it lays out in a financial incentive system to compensate. It could be physicians, it could be dietitians, could be whoever, health coach, somebody like that. But it compensates those individuals for making people healthier. So if we see somebody that reverses their diabetes, reverses their heart disease, they actually get additional financial compensation for that. So right
Mhm.
now, if a physician um, works with somebody and puts them on a plant-based diet, they reverse their diabetes, they have great health, they may never see that physician again, or maybe once a
Uh-huh.
year, that type of
Yeah.
thing. Right
Yeah.
now, they're seeing them, 4 or 5 times a year to adjust medications and things like that, and
Right.
they're taking all these medications. So it might cost the employer $15,000 for that diabetic. But once that diabetes goes away, those medications go away, maybe a couple $100 a year, maybe $1,000 they might charge. So there's that significant savings there between that
Right.
15,000 and 1,000. And so what my paper proposes is that you take a portion of that savings and you pay it as a bonus to whether it's the physician, the health coach, the nutritionist, whoever helps that patient overcome their chronic disease and
Okay.
get healthier.
Is there a link we could put in the show notes to that paper?
Yes, we can get you a
Okay,
link for that.
so please send me that. We'll put that in the show notes. I urge my listeners to read that. I'll read it as well. And keep up the good work trying to use the capitalist system to help people, because it can be done.
Yes, it can. Yeah.
Thank you, Ken. It's been good to talk to
Glenn, thank you very much. Appreciate it.
you.